Welcome to Inside 340B Report, an insightful conversation between 340B Report's editorial team on the key issues affecting the 340B drug discount program, the nation's second largest government drug program. Hello, and welcome to the latest episode of Inside 340B Report. I'm Ted Slafsky, 340B Report's publisher and CEO. I'm joined today by 340B Report associate editors and senior writers, Shannon Young and Will Newton, and Luke Zarzecki, our national correspondent. Before we dive into the latest 340B developments, I want to let our listeners know that we're pleased to offer a special 25% discount to 340B Report first-time subscribers. You can go to the subscribe tab at 340breport.com and use the coupon code podcast25 to take advantage of the discount. I know you will find our news service to be a valuable investment. Also, I want to encourage you to check out 340B Report's business-focused podcast, 340B Leaders Up Front, hosted by Anna Mangum. The podcast showcases conversations with industry executives who are at the cutting edge of innovation and leadership in the 340B space. There's been a lot of major developments in the 340B world since our last episode. Today, we're going to discuss the latest in Congress, including recent hearings, competing letters regarding the 340B rebate pilot, a potential new bill to exempt more providers from 340B rebates. Also, we'll cover a major drug industry trade group's reported seven-figure ad campaign on 340B. This is their second one with that type of money behind it in just the last few months. And the latest legal developments, including new federal court rulings and potential enforcement actions related to one state's 340B contract pharmacy access law. Let's start with Congress. Shannon, you've covered a couple of recent congressional hearings where lawmakers and witnesses brought up the 340B program. Can you tell us more?
Yeah, of course. So we'll start with the latest hearing, which was a Senate Health, Education, Labor, and Pensions Committee hearing. So that's also known as the HELP Committee. And they had a field hearing in Baton Rouge, Louisiana. And so it's kind of a more informal type of hearing than you would see in Capitol Hill. This one was led by Chairman Bill Cassidy, who is a Louisiana Republican. He's also a pretty well-known figure in the 340B world. He's a very vocal critic of the program, has launched some investigations into it, and is somebody we've talked about quite a bit on this podcast. And so, as I said, Cassidy led this hearing. He was the only member from the committee there, and he had about a handful of witnesses. They were talking about healthcare costs and represented different parts of the industry. And so this is noteworthy for a couple reasons. Namely, Bill Cassidy is up for re-election this year, and he faces a pretty tough race to hold on to his Senate seat. Right now, the most recent polls give his GOP challengers, who are Representative Julia Letlow, who's a congresswoman from Louisiana, and Louisiana State Treasurer John Fleming, the edge in that GOP Senate primary. And there's about 10 days or so left before that contest. And so, Cassidy is in his district. He's trying to build up some support for some bills he's been pushing in Congress. So not necessarily there to talk about 340B specifically, but some other healthcare priorities he had. So he was pretty quiet on 340B at the hearing. He did make a couple mentions of it, but the most pertinent for our listeners here was a witness named Kathy Oubre, and she's the CEO of Pontchartrain Cancer Center in Louisiana, and she's also a board member of Community Oncology Alliance, and that group is also known as COA. We've talked about them a little bit. They've been pretty vocal in calling for 340B reform, mostly reforms that would cut back the program's scope. And noteworthy about COA is that their corporate partners include drug manufacturers. So in her remarks, Oubre brought up her claims that the 340B program should be reformed and asked Congress to take a look at this. Cassidy also noted in his very brief remarks on 340B that he's, quote, not sure how, but Oubre had recently gotten access to a database, and when she could look at the impact of 340B in each state, and that he sent her a list of states to look at so he could share the findings with the Health Committee senators. So that is something that we will keep an eye on and see what comes of it. Again, noteworthy is Cassidy has been leading an investigation into 340B. And so I don't know if it would be part of that probe or not. And also it could depend on what happens with this upcoming election on May 16th. If there is no clear winner with a majority in that election, the top two finishers will move on to a June runoff. So again, we'll be keeping an eye on what's happening in Louisiana, but that is what happened at this most recent hearing.
Shannon, I wanted to ask you a question regarding that. I know that there's always been tension between the 340B hospitals and the private oncologists. As you may recall, that private oncologists complain because they aren't able to access 340B pricing, but the hospitals make the point that they serve a much larger number of low income and other vulnerable patient populations at hospitals. And so I don't know if any of that came up. I doubt it in this particular hearing, since it didn't sound like there was any spokesperson for a hospital on board. Is that right?
Yeah, the hospital side didn't really have a lot of say. However, Uber did note some of their criticisms with hospitals and 340B is that there's a lot of consolidations that happen and that hospitals are getting this benefit that they're not when they believe that independent cancer centers could treat patients cheaper than a hospital could. There was also a pharmacist who mentioned some of the issues there between independent pharmacies that aren't able to access the 340B program as part of these larger hospital groups due to different contract pharmacy rules. So it did come up a little bit, but it wasn't a ton of advocates or hospital side being represented.
Thank you. And that is interesting. These field hearings can be quite different. I mean, sometimes you got lawmakers from both sides who attend these hearings throughout the country, and sometimes it's really the chairperson and only their local constituents. So it sounds like this one was the latter.
Yeah, definitely. So it'll be interesting to see what comes back to the full committee after this, because again, all of this is going onto the congressional record and will be shared with all of the members. And then switching gears to a more formal hearing that we had recently that touched on 340B. On April 28th, the House Ways and Means Committee held a hearing on rising healthcare costs. And that one did include some hospital leaders. It began with Chairman Representative Jason Smith, who's a Republican from Missouri, who in some of his opening remarks took aim at 340B hospitals. Specifically, he argued that large hospital systems, quote, manipulate the 340B drug pricing program to keep steep drug discounts for themselves instead of passing the savings to low-income patients. He and GOP lawmakers also questioned some urban hospitals' use of a rural referral center designation, saying why should hospitals in these large cities be using rural designations to benefit from 340B? And things like that. So some of the lawmakers that raised some similar questions were Representative Carol Miller, who's a Republican from West Virginia. She said she's, quote, disturbed at the trend of rural hospitals getting taken advantage of. Representative Darren LaHood, who's a Republican from Illinois, said that he supports safety net programs like Medicare, Medicaid, and the 340B program. But he argued that lawmakers, quote, must ensure that this lifeline reaches the vulnerable patients and rural hospitals that the program was intended to serve, end quote. On the other side of things, we had Brian Donnelly, who is the president and CEO of New York Presbyterian, which is a New York-based health system. And he was one of the witnesses who testified before the committee. He pushed back against some of these Republican assertions that hospitals are manipulating the 340B program and misusing it. New York Presbyterian, notably, and some other large urban health systems have faced scrutiny for their use of 340B program and what critics contend is a loophole that allows them to be classified as both urban and rural health systems. Notably, there was, I believe, a Wall Street Journal report that called out New York Presbyterian for this practice. And so it's been something that quite a few lawmakers have been talking about in the past several months here. Smith brought it up at a hearing in the fall. He also asked HHS Secretary Robert F. Kennedy Jr. at another recent Ways and Means Committee hearing to commit to, quote, putting in guardrails and engaging with states to ensure rural health transformation program dollars go to truly rural facilities. This is a theme we've been seeing, especially in the Ways and Means Committee, and we've had some lawmakers looking at legislation to sort of crack down on this designation. New York Presbyterian pushed back, said, well, we serve a lot of patients who come from rural communities. They're referred to us, and sometimes we are the closest facility. A lot of lawmakers scoffed at that, but as somebody who lives close to New York in a rural area, we do exist, so it could very plausibly be. But yeah, that is sort of the back and forth that we heard on the Hill during this hearing.
Yeah, and Shannon, I think that's interesting because the very notion of a rural referral center is that it's actually often not in a rural location, but is the prestigious academic medical center that takes care of rural patients. And so it'll be interesting to see whether there are any changes in that designation. Seemed to be a theme that RFK Jr., Secretary of HHS, also brought up, the theme that the rural hospitals are getting screwed under this program. I'm not sure if that's really the case, but it certainly makes for a good soundbite. So it will be interesting to see what happens there. But that seems to be a theme that is perhaps getting some traction on the Hill.
Yeah, I definitely agree, Ted. I think we've been hearing this come up way too much in the past several months for there not to be something potentially in the works behind the scenes or conversations being had about it. So it'll definitely be something that we keep our eye on. And speaking of Congress and activity on the Hill, Will, you wrote recently about a new letter that was related to 340B and rebates and all of that good stuff. What can you tell us here?
So as 340B has been coming up repeatedly in all of these hearings, it has also been coming up in a series of letters that different lawmakers have sent regarding the potential of a 340B rebate model. And this is coming as HRSA has recently requested information and put out some documentation signaling that it is likely going to attempt to implement another 340B rebate pilot after courts blocked its last one from taking effect at the start of this year. And the big development since our last podcast is that 7 House Republican lawmakers finalized and sent a letter to RFK Jr. and HRSA Administrator Tom Engels supporting a 340B rebate model. They were arguing that a rebate model would add much needed transparency to the 340B program and allow Congress to get more insight into how the program operates. That letter was led by Representative Diana Harshbarger, who is a Republican from Tennessee, and Representative Buddy Carter, who's a Republican from Georgia. And if their names sound familiar, that's because we've talked about them a lot in this podcast. They're both pharmacists by training and have been very active on the 340B program and have frequently called for 340B program reforms, and are also the only current 2 sponsors of the 340B Access Act, which is a pretty significant 340B reform bill. And so these lawmakers sent their letter, and that happened a little bit after, and I know we mentioned this in our last episode, a large group of about 90-something bipartisan House members sent a letter urging congressional appropriators to ban the use of federal funds for a 340B rebate. There was also a companion letter sent out by 9 senators. These were 8 Democrats and 1 independent who typically caucuses with Democrats, basically saying the same thing, urging congressional appropriators to block any federal funds from being used on rebates. And so these dueling letters are pretty interesting because if you look at the one that Carter and Harshbarger sent supporting rebates, it definitely looks like it could have been drafted by a drug industry trade group. And then if you look at the letters that these lawmakers sent opposing rebates, it looks like it could have been drafted by a provider trade group. And so it'll be interesting to see to what extent these letters have any major effects. I would imagine that both sides are going to be citing those letters as evidence that congressional lawmakers are on their side. So that's certainly something that we'll be following closely.
And Will, I know that there was some questions to RFK Jr. during his recent testimony regarding what is the administration's position on the rebates. And There was some concern as well from some Republican senators about the rebate proposal. Could you just briefly mention that?
Yes. So during an HHS budget hearing, two Republican senators, Senator Moran and Senator Rounds, both asked RFK questions about the status of the rebate pilot. RFK largely sort of ducked the questions. He said he wasn't really sure what the status of the rebate was. And when pressed by Senator Moran, he agreed that he would direct HRSA to brief the Senate working group that is working on a 340B legislative proposal, that commonly known as the Gang of Six, the six bipartisan senators. So we are yet to hear whether or not this briefing has materialized, but it did seem like, at least from those brief exchanges, that RFK was not completely up to speed in terms of where the agency stood on the rebate pilot at this point.
In fact, if I recall, he mentioned something about, I'll have to ask Dr. Oz about that, but not realizing that CMS is not the one that is taking care of this. It's HRSA. Is that right?
Yeah. It looked like there is some potential confusion there as well in terms of which agency within HHS is actually responsible for working on the rebate pilot within the 340B program. And speaking of 340B rebates, all these back and forth in Congress, Luke, you did some super cool reporting and came out with an exclusive about a bill that we are expecting to see introduced coming up. Can you tell us a little bit more about that?
Yeah, so a new bill that it's expected to be introduced. It is May 7th when we're recording this, in case it does come out since then. But the new bill called the Safety Net Provider Drug Pricing Protection Act 2.0, to come from Republican Representative Jack Bergman from Michigan and Democrat Representative Raul Ruiz from California. That is supposed to exempt more covered entities from any rebates. And it's a long time coming from the bill, because back in February, Representative Bergman, along with Democrat Jake Auchincloss from Massachusetts, they introduced a bill that exempted only federally qualified health centers, FQHCs, from any proposed rebate model. So this bill that's expected to be introduced has been a long time coming, just because Bergman's office told us at the time when they introduced their February bill that they were working on a bill to exempt more covered entities. And so this new bill would exempt certain covered entities, both from rebates from pharmaceutical companies, as well as a rebate model at the federal government. And so what this means is that a covered entity would not pay more than the 340B ceiling price at the time of purchase. And so those covered entities will include FQHCs, critical access hospitals, SOL community hospitals, Ryan White HIV/AIDS clinics, Black lung clinics, hemophilia treatment centers, Native Hawaiian health centers, and direct funded sexually transmitted disease and tuberculosis clinics. So notably, the bill does not include rural referral centers, disproportionate share hospitals, or freestanding children's hospitals. And it would also not apply to family planning clinics or AIDS drug purchasing assistance programs, also called ADAPs. And so a source close to the bill told us that lawmakers decided to add to the list of those exempted from a potential rebate model after conversations they were having with other members of Congress. And this bill aimed to strike a middle ground between the alleged misuse of 340B by large hospitals and covered entities' financial concerns of fronting the cash for the entire amount of drug at the time of purchase.
That's quite interesting, Luke, and we'll be very eager to keep an eye on that legislation. Nice job on getting that scoop. And I guess since Congress is technically on recess right now, perhaps it may take another week or so before that bill gets introduced. But you can count on Luke and the team to be the one to break that news when it is finally introduced. So, Shannon, turning to another topic, the group PhRMA, which is the trade group for the brand name drug companies, once again is starting up another ad campaign and another high dollar one. Can you tell us more about the latest?
Yeah, of course, Ted. So Pharmaceutical Research and Manufacturers of America, as Ted says, known as PhRMA, they released a 30-second video ad this week arguing that 340B medicine markups are a, quote, gold mine for big hospital systems. Bloomberg Law was the first to report on this, and they noted that it's part of a 7-figure advertising blitz. If that sounds familiar, it's because it is. In the fall, PhRMA also launched another 7-figure ad campaign that was targeting 340B hospital markups, which at the time was reportedly the biggest ad campaign PhRMA has had yet on 340B. And so that last ad campaign ran through the end of 2025 in the Washington, D.C. area. I asked PhRMA for some details about this ad buy, how long is it going to run and what areas, and they just referred me to Bloomberg's story, which didn't note that information. And so it's kind of unclear at the moment. I guess we'll have to wait and see. However, a PhRMA spokesperson did tell me that the new ad campaign highlights how large nonprofit hospital systems can exploit the federal 340B program for profits that can be used in egregious ways with no patient benefit. And so the ad sort of highlights that. It features a handful of nameless fictional hospital executives who are talking about how they can use the 340B program benefits, and they end up using them for services at a fictional 340B executive spa and yelling out, "I love the 340B program." And so the ad is part of a campaign that's known as Goldmine. And so I expect we will see other ads that are similar to this running in the next several weeks. But this is all part of the messaging that PhRMA has been pushing for several months now, taking aim at hospital quote markups on drugs. They've argued that penny pricing allows hospitals to get these drugs very cheap and then charge large amounts of money for them and make lots of profits off of it. 340B advocates have argued that those claims are misleading. The American Hospital Association told us that this ad was a classic PhRMA move, shifting the blame to divert attention away from a problem of their own making, skyrocketing drug prices. And America's Essential Hospitals also said that the ad campaign willfully misrepresents the 340B program, continuing to put PhRMA's profits over the well-being of patients. So that is what we saw come out this week. We will be keeping an eye on this blitz and seeing, what else pops up and what these ads say. But yes, this is the latest here.
And Shannon, I thought that was interesting. I didn't realize the new fad is to put cucumbers over your eyes while you're at the spa. That was an interesting little touch there.
Ted, you got to get to the spa more often.
Yes, yeah, I guess so. Well, I guess we're not benefiting the way others are from this program. Now, I know that the hospitals were, my sources say they thought it was completely an unfair representation of the program, but it was certainly, to me, and I think to all of us, we got a bit of a kick out of the ad. It had a little bit of humor in it. So thank you, Shannon. Before we continue, let's take a moment to hear from one of our great sponsors.
Is your TPA draining the resources you need for patient care? When vendors fragment your data, you don't just lose savings, you lose the ability to expand access. Stop the leakage. Nuvem Rx delivers a truly integrated ecosystem, unifying claims capture, referral compliance, and pharmacy management in one audit-ready platform. We don't just manage 340B, we fuel it. See why covered entities are switching to the single-source solution. Secure your mission at nuvemrx.com.
So, Will, there's been a lot going on within the states. So curious whatever legal developments you have for us.
Yeah, there has been quite a bit happening in the States. And a really big development recently is that the Louisiana Attorney General indicated that she and her office are preparing to take some enforcement action against manufacturers that have allegedly violated the state's 340B contract pharmacy access law. And so Louisiana, as many people who have been around the 340B program will remember, it was just the second state to pass a contract pharmacy law. We're now up to over 20, but it was just the second. And earlier this year, in early February, the Fifth Circuit Court of Appeals, the federal appeals court, a 3-judge panel unanimously upheld that state law against a handful of manufacturer legal challenges, which likely sort of set the stage for the state to begin taking a stronger enforcement position there. And so the Louisiana Attorney General, she said in an interview with a legal news service that her office was preparing to take enforcement action. She said her office had received a number of complaints about manufacturers that had allegedly been violating the state's contract pharmacy law. After that, we reached out to her office, and as of May 6th, a spokesperson for the Louisiana Attorney General told me she did not believe any enforcement letters had officially been sent out yet as of May 6th, but referred us to the Attorney General's comments to the legal news service, where she indicated in very clear terms that that was sort of on the horizon. So that'll be something really interesting to hear, because I remember back with Arkansas, which was the first state, a similar sort of story unfolded where after the Eighth Circuit, which is another federal appeals court, unanimously upheld that state's contract pharmacy law, the state insurance department sort of started taking a much more active stance in enforcing the law against manufacturers that had not exempted providers there. So that's something we're going to be very closely following. And it'll be interesting to see if more manufacturers and their contract pharmacy restrictions end up exempting Louisiana providers, whether or not the Attorney General really takes some strong enforcement action, and what happens from there. So we'll be closely following that as well.
You know, you talked a little bit about sort of the history of Arkansas. It took a good year or so once they started enforcing it, if I'm correct, before all the drug companies agreed to restore the discounts. If I recall, AstraZeneca was sort of the last one, but that it can take a while once the actions begin. Is that right?
Yeah. So what happened in Arkansas in pretty broad terms was after that Eighth Circuit ruling, a number of manufacturers just sort of on their own updated their policies to say they were exempting Arkansas providers from their 340B contract pharmacy restrictions. From there, the Arkansas Insurance Department started sending out some letters to manufacturers that had not done so already, based on complaints that the office had received. And from there, most of those manufacturers, as a result of those letters, basically agreed to exempt providers in the state according to that. As you mentioned, the one really major manufacturer that did not do so was AstraZeneca. And then what happened there was the state went ahead and initiated its formal enforcement procedure, which was kind of a trial-like thing that took close to a year, if not more, for all of the parties to present their evidence, get a neutral judge to issue a decision, et cetera. And then from there, the Arkansas Insurance Commissioner ultimately required AstraZeneca, found it in violation of the law, and required it to start providing 340B pricing to contract pharmacies. AstraZeneca is still in the middle of an ongoing federal court case with the state. So that was sort of a lot of details there, but basically the main point is that I would imagine that once these letters go out, a lot of manufacturers will just sort of privately communicate with the Louisiana Attorney General's office to avoid being in poor standing. And then from there, if there are any holdouts, then that's sort of where we might see enforcement action. Again, the Louisiana Attorney General office and how it enforces is very different from how the Arkansas Insurance Department or any other state enforces their specific laws. So there could be some differences there.
That state attorney general in Louisiana has been getting a lot of national attention on her efforts on a different issue having to do with a medicine for abortion. And there's been a big Supreme Court case going on. So I think she's been quite busy over the last 10 days or so. And that brings us to the end of today's episode. We'll continue to keep an eye on all things 340B related, and we'll be back in 2 weeks with a new episode. Of course, we will report on anything that happens in the meantime on our website. Please follow along with our twice-weekly newsletters. And just a reminder, if you're not currently a subscriber, you can take advantage of our 25% discount for first-time subscribers by going to 340breport.com, clicking the subscribe button, and using the discount code podcast25. Thank you for joining us, and we'll see you in 2 weeks.